Welcome everyone to today's Intersex Awareness Day 2023 webinar. Happy Intersex Awareness Day, everyone. Today's webinar is on introducing InterLink, our peer-led and community-controlled intersex psychosocial support program, and about starting conversations about InterLink. About intersex and InterLink. I'd like to start by acknowledging that we're all gathering today on unceded country and pay my respects to Aboriginal and Torres Strait Islander elders past and present. We extend my respects to any First Nations people here today. My name is Bonnie Hart. I am the InterLink manager. I am the program creator and manager. I'm an intersex woman. I use she, her pronouns. I'm also the Deputy Executive Director of Intersex Human Rights Australia, and wear other hats in the community and have had such as having long time associations with Intersex Peer Support Australia. I have my own lived experience of engaging with medical and social environments related to having an intersex variation and having an intersex trait that exists within a family context as well. I have a background in studying psychology and also art, but also I am currently a PhD candidate at the University of Southern Queensland. I'd like to introduce to you as well to my co-presenter today, Natalie Hamam, Natalie, please introduce yourself.
Hello, hi everyone. I'm Natalie, or Nat, either name is fine. I'm in Albury, New South Wales. I just want to echo Bonnie's acknowledgement of country. This is Wiradjuri country. It always was and always will be Aboriginal land. I'd like to pay my Injamara, my respect to any Aboriginal elders, past, present and emerging. So I'm the mental health practitioner for InterLink. I feel very lucky and privileged to be in this role and love the work that I'm doing. I'm not an intersex person, so I am endosex. Other than being a mental health practitioner, I'm also an occupational therapist. So been an OT for 20 plus years, and for about 11 of them I've focused on sex and disability, or dating, friendships, sexuality, puberty, gender issues. I did a graduate diploma in sexual health and also did a research master's around sex and disability, where I got to interview people that had disability but had the type of sex life where they wanted to talk about it and share their ideas with other people. So that's where I learned a lot, and I'm very grateful to have been able to learn from a lived experience of people with disability. So thanks for having me.
Thank you, Nat. Thanks for joining us. And thank you everyone for coming and making time today on Intersex Awareness Day to learn about intersex issues from people with lived experience and endosex allies that work with us. So our session today will cover a range of topics. We'll mostly be looking at a little bit around what intersex is, and then looking at some of the kind of mental health concerns that people with intersex variations face, and some of our community-based responses to that. I will do a deep dive into what InterLink is, how we work, the model we use, and also how to connect people with our service. So as we're recording today, I invite you to use the chat to ask questions, but we will be answering all of those questions at the end of the session rather than periodically. But feel free to put questions in there and we can come back to them as we go. Because it might be answered as we cross that topic later on down the line. So without further ado, let's kick on. So it's intersex, like I is not for invisible, I suppose, is one of the major reasons why intersex awareness is so important. Awareness is one of the major reasons of overcoming stigma and misinformation. Many people with intersex variations still have to educate service providers to have their intersex body known or have their variation known about. So actually awareness is that frontline proponent to having your needs understood and met in society, but then also to know and understand your own needs yourself. So the 26th of October is celebrated as being a day of intersex visibility. And was first, it was a recognition of a first public demonstration in 1996 in Boston from two people with intersex variations who tried to join a pediatric conference and were refused entry. And so there was a public protest as a result. There's a 2-week period which spans between Intersex Awareness Day and Intersex Day of Solidarity on the 8th of November, which commemorates the birth of Herculin Barbin, who was a French 19th century person with an intersex variation and one of the first recorded personal accounts of what it was like to live in that society with a body that didn't conform to male or female stereotypes. I invite you to continue to show your intersex allyship by checking out the Darlington Statement, which is a fundamental community consensus statement. You can affirm that at the website on the link. So you've got darlington.org.au/affirmation to show your ongoing commitment to achieving the Darlington Statement, which is sets forth the community demands. There are also other options to learn more and educate other people that you work with through engaging with our yellow tick programs of training and resources. You can find these at yellowtick.org.au or darlington.org.au/yellowtick. And again, like, our awareness really is best when it's embedded into practice, and that practice around awareness is around finds its way into inclusive practice. So there are some really great resources around intersex on the ERA website, and the inclusion one is certainly a great place to start on a day like Intersex Awareness Day. So when we talk about intersex, we're really talking about a very diverse group of people in a population. The term that we use is a term that's used to describe any innate variation in sex characteristics, so sexual anatomy, reproductive organ, hormonal patterns, or sex chromosomes that vary from stereotypes for male or female bodies. We recognize that there are a lot of different terminology used in this space, and many intersex variations can also be described using clinical or diagnostic terminology. These can be related to differences or disorders of sex development, or diagnostic specific terminology, or descriptions of physical states of being. So you can note in the terms that we show here that there is nothing really about sex category or gender identity in the way that we use and talk about intersex or sex assignment at birth. And the term intersex is generally used, and we use it because it is one of the most commonly accepted terms in the community, and links to people of all life stages, so including fetuses, embryos, infants, children, adolescents, adults, and older people. But it's also really good to recognize that not everyone has a clear diagnosis of an intersex variation. Some people might be re-diagnosed at a different point of their life, or people may not have clear information about their bodies or the procedures that they experienced before they could clearly remember what those procedures were. And so there's a lot of lack of knowledge around, by some members in community, around what their body is or what terms they use to speak about it. So people really do use a variety of different terms to talk about their bodies. And they use the terms that they know or that they've been taught. So we can be taught terms predominantly through our contact with parents or doctors when we're younger people, but then also we find terms out there when doing our own research as well. We're also really conscious that, like, language changes in different contexts. So people talk about their bodies and use different terminology in incredibly different ways, depending on who they're talking to and what they hope to achieve from that engagement. So people may use more clinical terminology to talk about their bodies in a clinical context or a medical or service provision context, just so that they can be known or have that part of their intersex experience be known and receive a health service that is appropriate. So this is what we call code switching. And people do this for a variety of different reasons. Firstly, it's to be understood, to have their language be known, to overcome any misconceptions about what they're talking about. So it's around access to different spaces, including healthcare. It's around kind of doing away with the stigma that has existed around intersex or any of the other kind of language that isn't used in this anymore because of a pejorative nature of that language. People use different language to avoid being misgendered or othered. If people are making assumptions that every intersex person is non-binary or it has a third sex marker, then they might not use that terminology because of those misconceptions and having to find the words to be able to explain why that's not the case in their circumstances. But the other great thing about intersex is it does cross across many different variations. It talks about variations in sex characteristics. So it is a common meeting ground for people who are otherwise might find themselves to feel very rare or very isolated in community, in society, and in service provision. And so it provides the opportunity for a sense of belonging and social connection and sharing those types of information. And generally we use the language that we feel good in. So we might use different language when we're talking with our peers and with our friends and with our partners than we would do with our parents or in a medical environment. And this is a way that we learn to accept ourselves in whatever part of the journey towards self-acceptance that we're on, or whatever information we have about our body, and hopefully towards that direction of intersex pride. So intersex awareness is really important, specifically because of the impact of a lack of awareness and what that means when a person who is in a service provision context or it is providing a community group service, a LGBTI community group service, or a government is making government policy, when they don't have clear understanding or awareness of what intersex means and what it's like to have an intersex body and engage in a family system or engage in a healthcare service. So part of that awareness is around that kind of providing more information so that we can tackle some of the stigma that's associated with being marginalized within the world.
Yeah, so for me, in starting this job, I've had to face up to my own lack of awareness. I saw the job and thought, oh, this looks interesting. I know what intersex is. This could be perfect. But actually, by going to do some research, I realized I know very little about intersex. I had no idea about the human rights violations that have happened and that are happening. I knew very little about the amount of stigma and secrecy and shame that was associated with growing up being intersex, and the lack of openness about it that starts before kids can speak, so that it's coming from doctors or family members where if they know, then they're told not to tell anyone else. So I felt looking at the resources before I even applied that I don't know enough to be able to do this work. And so for me, I've had to face up to that lack of awareness. I've been someone that provided education on puberty and relationships and sexual function, and realized, well, that was a very endo-sexist perspective, and I didn't include an intersex perspective in any of the work that I've previously done. And you feel that sense of professional shame in a way that, whoa, I missed all of this. I missed it in my graduate diploma of sexual health. I missed it in any other training that I did in allyship with the LGBTQI spaces that I'd been in. So yeah, it is confronting to recognize your own lack of awareness as a professional, but thankfully, facing up to it and then wanting to get up to speed that was able to be done because there's a lot of well-developed resources that I used and that were shared with me in order to be ready to be a mental health practitioner with people that are intersex. So, you know, the yellow tick training that I did was some of the best training I've done in my whole career, and documentaries I watched, podcasts I listened to, the ERA website, so the Intersex Human Rights Australia website. It was, you know, really easy to browse and to read, to have a bit of text and then a story that illustrated it. So yeah, I did manage to get up to speed quite quickly because of the developed nature of the resources and the work that's gone into putting it together, because it's quite a complex issue. It's got a lot of political and history and medicalization that can be overwhelming to kind of synthesize, but the work's been done, I guess, to make it clear and to show what the issues are going to be, and how, and then obviously how they impact mental health. So on the next slide, you know, there's this synthesis of generalizable mental health concerns that kind of everyone's individual, but you can see there are going to be overlapping features, even if someone's you know, condition is, you know, their variation is different to someone else's, or their gender identity is different. There are interpersonal and social issues that have a common experience, and frequently, you know, involve things to do with potential bullying, family dynamics, hiding the truth, problems with relationships, problems with sexual intimacy, the isolation that is sometimes chosen because someone is not able to relate or doesn't want to be social due to fear, and isolation that's not chosen, you know, because people have in some way been excluded. And so mental health issues to do with depression, anxiety, post-traumatic stress disorder, and complex post-traumatic stress disorder, where you know, the traumatic events happened throughout childhood that were repeated, and they were complex because they were, you know, from people that should have been taking care of them, so health professionals, where there may have been surgeries that weren't explained in any way, that had consequences that also the child or the young person or the young adult wasn't able to kind of recognize, I need help with this. So the health issues, the body issues, the mental health issues, and the interpersonal issues all kind of overlap and create real difficulties in being well and in having good health, and also good mental health and good well-being. And so we have a way for people to come together and start unpacking some of these issues that, other than not being able to talk to someone else about, like some people have been to mental health practitioners in the past, but not really unpacked their intersex variation because they didn't know it was an intersex variation. They just saw it as whatever the condition was called, and saw it as, you know, one small part of their story. Whereas some of the things that they, you know, have had to deal with, to do with not being able to maybe create a family in a heteronormative way, or having faced discrimination, the impacts that the lack of self-identity development has then impacted on self-esteem and how they see themselves. So there is a lot to unpack, and it is, you know, really interesting to see the groups, as Bonnie's going to share about, that people come together and start to unpack the issues, and by feeding off each other, they are able to kind of make huge lists of overwhelming things that they've experienced to do with navigating the health system, this one-off doctor experience that happened that gets shared as a horrific experience. Other people in the group are also sharing such similar experiences, and then the impacts that's had on them. Key moments of people's lives and transitions to do with puberty, and then, you know, the aging process that happens as well is another key time that people are able to recognize, hang on, I'm looking backwards at my life and thinking about how has being intersex actually impacted everything from when, you know, I was a kid to now. So yeah, it can be kind of overwhelming to look at all of the different interacting impacts of having an intersex variation, and it's not just held within the person's body, it's actually how it's been treated from the outside by society, and the level of acceptance in having anything that makes gender different, and how we talk about those things, so the words that have been used. And so, yeah, we bring people together and unpack this. And can talking help? Certainly, yes. I had a very strong belief in that before being in this role, but now, you know, being able to see the impact that talking about these issues has, where someone moves from not really being able to think about this issue properly to being able to name it, talk about it, and talk about it in a group. It's quite incredible to see the impact that can have, that being able to start the conversation about intersex and tease it apart and put some of the blame and shame rather than on themselves, but where it needs to go. It's incredible work. So the talking helps, I guess, by, you know, giving a language to begin with, and then also moving that towards an affirmative language where there's a process happening in these conversations. It's not just a conversation, it's much more powerful than that. And certainly the program has an individual component and the group component. That's where I have seen the reduction of the stigma just start to go down by having solidarity, by hearing someone else's story and being able to acknowledge it, show empathy, because the people have a lived experience of that. I don't have a lived experience of being intersex. I am a counsellor. I can listen and help people lay it all on the table and start unpacking it in a safe and confidential environment. But in the, you know, the InterLink process is a group process where peers are coming together about things that may have never been able to be spoken about inside the family, and yet they are coming together and talking about it with people that really get it. It's a safe space. Bonnie will talk more about how that safe space is involved in the program, as well as myself, and as well as Bonnie as the InterLink manager. So creating that conversation place where these things can be talked about openly. It's an amazing intervention in itself, and is having, outcomes that I haven't seen as rapid in my 20-year career, basically, to see change, you know, for people where their identity and their ideas of themselves are able to shift. And that's where I think the group work process is key to that transition. So, there's another.
I was just going to backtrack back to this slide, because, like, as you were saying, like these individual issues are so intersectional for people, and some can really be like layers, or where people determine the impacts, I suppose, of their previous experience, that and why those issues have come up now. But the other complexity in this, in terms of the breadth of issues that people face, is that the intersex community also involves obviously parents and caregivers of children with intersex variations, and children themselves. So people experience these types of issues in very different ways. So as a caregiver has an experience of health systems and cancer fears in a much different way than what a person with lived experience does, and so being able to create specific spaces where people can talk about those concerns and mitigate any types of concerns that they have are really important. Similarly, for creating spaces for young people to be able to talk about their experiences, and to be able to have safe and supported ways of being able to work through the issues that they're facing at the moment, even though they may not face many of these types of issues, because it may not eventuate that they come into being. Then that's also incredibly important process that we engage with. So yeah, talking really does help, I suppose, in terms of overcoming these types of issues that can be associated with our experiences, or actually just innately engaging with society and with a body that's a little bit different. But accessing affirmative language really does provide people with opportunities to talk about them and process their experiences. And often people have never had those types of spaces and dedicated timeframes to be able to do that. And as people, because of a culture around secrecy that's associated with stigma, people very much learn to not talk about them and to put these things on the back burner, not avoid conversations where they might come up, or situations where they may have to disclose that they have an intersex variation or have an experience of a childhood medicalization. So having those opportunities to be more open and talking creates more opportunities to socially connect and allow people more resources towards understanding themselves and understanding their experiences and their pathway towards self-acceptance. And really offering a gateway to peer support and seeing other people with lived experience is a really great and central part of psychosocial care and well-being. So that integration between clinical and community-based and peer-based services is really key to transition people from a medical environment that's often very short-term, often very concentrated in terms of the types of interactions that people have, and into more social community-based spaces where those supports can be more ongoing and lasting. So the outcomes, I suppose, of a psychosocial approach can be really compared to in terms of providing people increased opportunities to feel safe and to have full understanding about the types of experiences they've had, the types of services that might be affirmative to them. And when compared with a biomedical only approach, where people actually have limited resources to talking about their experiences, then this can create feelings of a lack of safety, particularly when people are forced to talk about their experiences at some particular point because of a circumstance, or trying to engage with a person, or trying to start an intimate relationship with someone and having to disclose about their body or experiences. So some of the benefits, I suppose, of psychosocial supports is around really improving those, like, self-acceptance and good self-knowledge, creating discussions around what sexual fulfillment looks like for people, and their ability to have healthy relationships, set good boundaries, and improving those good health-seeking behaviours that come from knowing and trusting that the health services that you're going to go to have more information and are going to be able to meet your needs, rather than putting yourself out there, having to say all this type of stuff and then have no support around when that goes, if that doesn't go well. But generally speaking, psychosocial processes, those are really about empowering the individual to have the self-agency to look after themselves, and obviously giving them dignity and self-respect as a process. So those real trauma-informed, strength-based approaches is really what InterLink is all about. So welcome to InterLink, everyone. It's a space for intersex people and people with intersex variations, their parents and carers of kids with variations in sex characteristics. So our objective is to provide mental health and wellbeing services to the whole intersex community. So to people with intersex variations of any age, and also to the parents, carers, and guardians of young people with intersex variations. And we do this to people anywhere in Australia through telehealth. So our services particularly are around providing one-on-one counselling and also group-based programs. We combine this with some community care coordination as well. So trying to connect people with affirmative services, with additional external supports, with kind of other psychosocial supports in their space, and also supporting them to access more information about themselves. So our InterLink services are short-term. So we generally see people over a 3-month period to try and concentrate our resources in that, in terms of that fast, beneficial kind of influence that we can have in that space. Our services are provided fee-free, and as I said, available to anyone in Australia through telehealth, so online video conferencing, such as we're doing now. InterLink's really not a crisis service, so we are designed to be a supplementary to existing support. So we encourage people who already have a mental health provider to still continue seeing that person, but to also engage with InterLink to talk very specifically around their previous experiences, and also some of the impacts that having an intersex variation has on their life. So our model that we use is based on a brief intervention therapeutic model. It's trauma-informed and strength-based, and really grounded in evidence and evidence-based practices. It's peer-led and community-based, and utilizes lived experience. It utilizes the lived experience not only of myself as the program designer and manager, but also the lived experience of the intersex peer workers who work in the group program as well. So our groups are co-designed and co-facilitated by the intersex peer workers and by the mental health practitioner as well. So the model is about bringing complementary skills together so that we're able to provide people with wraparound supports. And each person in that model, like each person brings different qualities and brings different expertise. So all of our workers receive general intersex awareness and sector-specific training, such as mental health practitioner training or actual peer worker training as well. So we have a real team-based approach, and also really work to ensure that our workers are supported in the work that they do through having access to a clinical governance framework, peer supervision, and employee assistance programs. So this is really great when working with lived experience to be able to set some of those effective personal boundaries, which can really lead to a high rate of burnout doing this type of lived experience work. So
we plan the sessions together, like as a group of 3, in terms of Bonnie, myself, and the peer worker. And then going forward, once we're into the groups, the peer worker and myself do a planning session. So we're actually kind of co-designing what happens next after we've met everyone. And we have a framework that Bonnie's piloted that we can base each session on, but we are kind of trying to meet the needs of the people in front of us in terms of we discuss how we facilitate and what we do before each session, and then afterwards we also have a debrief to kind of unpack anything we want to do better, or like what worked really well, and if something came up that was particularly difficult, there's time to it's a dynamic thing, so we can shape it to be however it needs to be, or however we think it's best going to work out for everyone. It has a workbook component too as well, which, sorry Bonnie, were you gonna so the participants they're face-to-face in the group 4 times, but that's fortnightly, and then there's workbook activities to kind of do by themselves. If they want extra sessions individually, they can ask for that, but the workbook, it's a great opportunity for them to reflect whilst the program's unfolding, or even if they go back to it later, there's things for reflection, and also for self-care and just taking care of the mental and physical things that can be churned up from doing the work. So
it's really about creating safe spaces, not just safe spaces for people to be able to talk about experiences that they've struggled to put words to throughout their life, or haven't felt safe to talk about in the past, but also safe spaces for us to be able to hold that information as well. So ensuring that no one person is left holding all of the information for someone, or holding all of the stress that's associated with that. So it really is a collaborative model in terms of ensuring that people have multiple sources of contact depending on who they feel comfortable talking to at any point, and that is staged over multiple contact points throughout the 11 weeks of the group program. It's also really having a mental health practitioner that sees people on a one-on-one basis as well is really great for people who aren't willing or wanting to do group work, and many people don't want to do that, or aren't ready at a place where that's going to be very helpful for them. So we're still able to provide them with ongoing one-on-one counselling when they actually aren't able to engage with those with the group work. The other great thing about the InterLink model is that we can provide people with ongoing referrals after the end of the brief period of time, or the end of the 11-week program.
And someone brought up in the chat that their kind of learning difficulties weren't picked up at school, and how that's impacted as well. And certainly there is an element of intersex variation having high levels of neurodivergence that maybe hasn't been picked up. And so sometimes people are asking for screening for that, and being an OT, I'm able to do some of that, and really looking at people getting knowledge about themselves. So that's about their variation. Sometimes that might mean getting their medical record if they haven't, but sometimes it's about looking at, well, what else is going on for me, because this is what my schooling was like, and that led to this, and that led to this. So going back and unpacking, is there something like ADHD, or are they autistic? They've suspected that, to kind of be learning about themselves in a number of ways. It's also part of the brief intervention model, where this self-discovery can be made, that knowledge can be celebrated, it's affirming, and then taken onto another service, or even accessing something like the NDIS. So, yeah.
I think one of the things that's really unique about InterLink as well is that it is an intersex community controlled program. So it's a program that's run by and for people with variations in sex characteristics and their parents. So this means that we're in a really unique position to be able to ensure that the types of peer services are really informed by our lived experience and our insider knowledge of healthcare systems and structures. It really does provide us with the opportunity to be able to educate others, and also provide a really supportive and connected space as people with lived experience. We also means that we know how to refer people to different kind of diagnostic specific support groups, or connect people with international networks of peers, which can be really helpful for some people who have quite rare intersex variations and really want to find someone with the same type of body as theirs. Our peer-based networks are actually quite sophisticated and broad-reaching, and we're able to tap into that through being an intersex community-controlled program.
Yeah.
So our modus operandi is about bringing people together to talk about living with innate variations in sex characteristics, with the support of trained counsellors and intersex peer workers. So this is structured and supported talking. We do this in the group-based format with people with different ages, to ensure that the types of conversations that people have are relevant to them, and that they're able to, during the brief format that we have, dive as deep as they can. So we currently offer groups to people over 10 years of age, and parents, carers and guardians. So when we look at our group-based therapeutic model, it's based on a brief therapeutic model, which is kind of designed to be easy to access and limited to a discrete period in time. So what that looks like is it's a 6-session program held fortnightly over 11 weeks. It starts with a one-on-one introductory session with the mental health practitioner, followed by 4 2-hour group work sessions. So this is with other group participants, and is co-facilitated and co-designed by the mental health practitioner and the intersex peer worker. The final session in the 6th session is a follow-up one-on-one session with the mental health practitioner, where we can go over anything that's come up during the group work session, and provide people with opportunities to access additional support, to continue seeing the mental health practitioner now that they've made a connection with them, and maybe have a bit more of an understanding of the things that they would like to explore further. So really the model provides the benefits of structured exposure to other people with similar bodies or experiences. And we also functions as a warm referral process. So both the peer worker, myself as the care coordinator, and the mental health practitioner are able to provide people with direction towards any type of service that they might want, or to try and assist them to try and find a group or a person that they need, or a piece of information. So the model is supported, as Nat was saying, by a workbook and with weekly activities and self-care. So this is a personal homework component to InterLink. Periodic supports are available between sessions, so people are able to have one-on-one sessions with Nat if any of the content that comes up in the group work has brought up feelings that they want to explore, or and also for the safety aspect as well. Our peer workers also are able to connect with people between sessions and connect people with other people to the sessions as well. So this is really about improving people's connectivity and resources and opportunities to be able to speak about their bodies or their children's bodies. And it does this through people meeting others. So this idea around visibility, seeing and being seen. It allows people opportunity to speak about intersex, to connect with affirmative services. And again, we have a massive focus on safety and confidentiality and well-being. And that's all of life well-being, yes. So when we look at what care coordination brings, we provide people support entering and exiting the group work program, and provide additional assistance from allowing people help getting information about themselves, access to other affirmative healthcare providers, can help people get connected with ally health services, and other community-based services that might be in their local area, or online. We can connect people with advocacy, systemic advocacy, and also legal advocacy, and other peer support groups, including diagnostic-specific support groups in Australia and also online internationally. So we're very much around this holistic model of psychosocial support, which really acknowledges and respects the diversity of intersex in all of its languages that point to it, and also all of the experiences that people have related to intersex. We're intentionally non-diagnostic specific, so our work is really about providing people with that structured, safe exposure to the diversity of bodies and language used in the community and in this space. So we provide, create opportunities to create safe and structured conversations to gain shared understandings, work through, including sharing tips and tricks to managing and understanding stigma and discrimination and how that can play out in people's lives. And the major objective is about increasing people's personal resources and agency. So this is resources to be able to connect with support, but then also resources to be able to connect with health allied services, to be able to know when and how to connect their children with supports, or have more kind of skills and knowledge around when is a good time to start talking about intersex, for example, or like ideas around disclosure and talking about healthcare moving forward and empowering people to be able to make those decisions for themselves. So fundamentally, we're about building relationships. So this is interpersonal relationships between people in groups, but also therapeutic relationships. There's so much pressure on people to have, when they're engaging with a new mental health practitioner, to have to educate around what their intersex experience is. So through engaging people with InterLink, which is a peer-based free service, then some of those barriers can be broken down so that people can start to form a relationship with a mental health provider and get a bit of discourse going on. So how do we connect in? People can register anytime through the website at InterLink. There's a lot more information about what InterLink is and how we work there. And the easiest and best way for someone to start engaging with InterLink services is to fill in the registration form that's available on the website. Our groups run periodically throughout the year. We really just run a group when there is enough people to feasibly be able to run one. We've run was it 3 groups this year so far, one being with parents as well, and we are currently taking registrations for groups commencing next year at the moment. There's no referral necessary for people to access our service, and it's still provided cost-free to participants. And I really encourage warm referrals. So I really encourage people, if they don't know if InterLink is right for them, they don't know if they even have an intersex variation, but they are suspicious that they have, or something doesn't make sense, to just reach out and make contact. My contact details are there. You can also make contact through the website. Or if you're a service provider working with a client with an intersex variation that needs support around that, feel free to get connected with us. We can certainly have 3-way conversations with your client and try and break down some of those barriers towards accessing support. So InterLink is proudly piloted through Intersex Human Rights Australia with the support of the Queensland Council for LGBTI Health. We're currently funded through our pilot phase through the Federal Department of Social Services for the next 2 years. But the service will continue beyond that point as well. But always looking for more and future funding opportunities to be able to ensure that these peer-led services continue to remain viable and available to people. So this is what the website looks like. There's a lot more information about InterLink on there. You can see the register button in the top right-hand corner where you can click and enjoy the wonderful pastel palettes, which is our giant Easter egg of intersex health and wellbeing. Thank you so much. We now have we've got quite a few minutes for questions. If anyone would like to jump in and ask any questions, you feel free to unmute and ask questions at the get-go.
Bonnie, I'm interested in sort of asking questions, but also just making a quick comment about a couple of things, if that's okay.
Absolutely. Hi, Julie.
Hi. Hello to everyone. This is probably my first serious engagement with the intersex community after having tentatively dipped my toe in the water of identifying as intersex and being encouraged to join this by Bernard Gardner, who you would know, I'm sure. One of the things I just want to comment on is that from my experience, and I'm an older person, that intersex was, or has in my experience been defined by who and what we're not. And so when the I was added to the LGBT mix of letters, that was a very helpful thing to me. But for a long time, I didn't even know that I was intersex. I think I mentioned in a comment earlier that it wasn't discussed with me. I think it was a bit of shame going on for my parents, and now all the medical records around the surgeries, etc., have been lost, which is, I think, a big shame. And so for me, not identifying as intersex was probably a form of protection, as in it's easier to be binary and not to identify as something that isn't well defined. So that was one of my hesitancies, I guess. I'm also very interested in information on what causes intersex characteristics, and I've come into this from the perspective of being a DES daughter. So my mother took diethylstilbestrol when she was pregnant with me, and that caused numerous problems. We know that that's a big issue in Australian women of around my age, as an endocrine disruptor that had horrendous and awful and lifelong impacts on people, including sons. So I don't know if that's another element for InterLink to kind of look into. I know it's very difficult to provide any definitive answers to what causes this, but I think I'm very passionate about finding out about DES, other DES people. So I don't know if that's on your radar at all. And for me also, because intersex is not just about our bodies. For me, I've always called it, maybe incorrectly, my brain sex is different, in that I always felt like I straddled to the two worlds until I understood that it's actually a continuum, if you like, and that it's not binary. But I came to the understanding for me that intersex was kind of my awesome superpower, that being intersex and being sort of somewhere that bridges to more accepted worlds was actually something that gave me an advantage, and I saw as quite positive, which has taken a lot of years to arrive at that point. So I'd be really happy to engage, and I'll follow up later about this in terms of peer support. But I'm really keen to put a quite positive spin on it too.
Really, thank you so much. What you've talked about really demonstrates the type of journey that people go on. That obviously you've gone on, but that it's quite common to see people go on these long journeys about trying to understand why, what, and how things have come to be in their lives. And I'm really glad that you've arrived at this space where intersex is actually I really hear a sense of pride in terms of having the body and the mind that you have. And I agree, obviously this is, as a person, as an intersex woman, I feel similarly. I think one of the things that InterLink really wants to do is make sure that people don't have to do that journey on their own, is because a lot of us have had to do that and to make sense of all of those things on our own time with our own resources. And it can be a hard journey. It can be very difficult, and it doesn't need to be that difficult. Certainly doesn't need to be difficult for future generations of young people, but also, having opportunity to be able to talk about some of those things and make sense in different ways in a group situation is really helpful. So welcome. I'm so glad that you've been able to connect with us. I think you brought up some really great points as well around kind of diagnoses and etiology of different intersex variations, and obviously intersex is a very broad term, and there are a lot of different types of knowledge that's related to different intersex variations and how they come to be. Some intersex variations come through very environmental factors, some are genetic, and some are hormonal as well. So people can, there's no one size fits all, like even for a variation like androgen sensitivity syndrome, some of that might be spontaneously occurring, or some might be kind of genetically common within the one family. So there might be a hereditary of that. So there is certainly a lot to be known. And really, that's one of the reasons why our psychosocial support services and the whole model of health and well-being has to really incorporate both a biomedical and psychosocial approach, but they have to work together to be able to ensure that we have access to quality information that really can help us understand how it is that we come to be in the world.
Graham has his hand up. Do you want to ask a question, Graham?
Oh, you're on mute. Thanks.
Sorry about that. It's a very common problem. So I'm Graham Nielsen, and I'm delighted to be involved here today. I'm a sexual health physician working at Stonewall Medical Centre in Brisbane. And I just want to ask or share about another group which meets regularly in Brisbane called GANK, the Gender Affirming Network of Queensland. And as many of us would recognise, there's intersectionality everywhere we look. And one of the areas where I see a lot of intersectionality is between the trans and gender diverse groups, which are typically designated trans, and they also, as a group, don't interface very often, or effectively for that matter, with intersex people. But I have seen a number of intersex people who have pretty serious gender issues. And so I'm sort of posing a question, I suppose, about firstly, whether people are on this group are aware of the existence of GANK. And then having said what I've said about it being very much a trans-focused group rather than sort of being sensitive or aware of intersex issues, whether that might be a useful resource for maybe some intersex people.
There's certainly an intersectionality, as you say, like that many people may only come to know that they have an intersex variation, so an innate variation of sex characteristics that, through a gender lens. So they like kind of there are people in the community who are both intersex and trans, and who know about being gender diverse before they know that they have a physical variation. So there very much is a crossover. I've presented InterLink at GANK before, so I'm aware of the Gender Affirming Network of Queensland. And as a person with lived experience, I've worked closely with trans and gender diverse people, just in terms of accessing affirmative services, because some of the endocrinologists and GPs and surgeons that we need to access affirmative services as adults with intersex variations are often the same, and there can be at least some common knowledge that those practitioners means that they actually are like a kind of a better place to receive referrals for intersex patients as well. So we're very I think that again, we're about providing specific support for people for the intersex experience and those people. But we work to try and work in collaboration with other services as well. Yeah.
Fantastic. And just a compliment. I think this is a fantastic development. So congratulations. Thank you.
Thank you. Thanks, Graham. We are at time, everybody.
We are. Yeah.
Thank you so much for joining us today. Natalie and my emails are on the screen. If you want to ask us any questions, feel free to get in contact. As we said, we're available for warm referrals or to run through these slides with your teams if you want to actually book us to present to InterLink to your service as well. So thanks so much, everyone. Happy Intersex Awareness Day.
Yay. Happy Intersex Awareness Day.